my name is Dr Carrie McCrea. I am trained as a general practitioner and a sports medicine physician. I trained in Edinburgh and have worked locally since then. I've had the benefit of working in high performance sport for a number of years now with a number of different sports, but also work with the team here in the private sector, looking after people who care about their own health and are looking to achieve sports performances within their own field as well. I work in professional football as club doctor at Hartland Midlothian Football Club, and I've been there for a number of years. I also work in high performance rugby, swimming and hockey, so the experience that that's given me has been absolutely brilliant to be able to bring to the public sector as well. I think there's a lot of lessons that can be learned from high performance sport that we can apply to the public, which will benefit everybody. So my colleague Lou Imrie, our physiotherapist here, we're very passionate about delivering that high performance standard to the public, and that has led us to collaborate with the team at the Edinburgh Clinic, because I think what we can offer here is exactly that. So it's expert opinions offered at a good price and at a point of access kind of care system. So that means you can come in and be assessed by all the specialties you would want to be assessed by on the same day, and get a sort of assessment, diagnosis and management plan all in one place, which I think is something that really is hard to find in other areas of the sector. What I would hope is that the referral in is very easy, so either self-referral from the patient themselves, or hopefully via their general practitioner, perhaps even their own physiotherapist out with. At that point we would expect for the patient to come in and for us to essentially triage in-house as to who the best person for them to see initially. It may be that they come to see me as the first point of contact. My area of expertise is to essentially work out who's best for that patient to then see, and if it's then appropriate they would see our orthopaedic team, perhaps with an onward referral for imaging such as an MRI, X-ray, ultrasound. Any diagnostic injections or interventional injections may be done at that point, and if it's conservative management, that might be then integration with Lou from the physiotherapy team. But the key thing being is that the care is individualised and specific to that patient. Obviously within the remit of what can be offered within the Edinburgh Clinic, if we felt it was appropriate from the sort of diagnostic processes for that to be offered, then we would aim for that to be absolutely streamlined. So the advice about what was needed and then the process would be discussed within the same appointment, and then the arrangements for that could be done on the same day, so that everyone's got busy lives these days, so that you leave with a very clear idea of what your onward management plan will be, and if that is operative intervention, you'll have a clear plan not only in terms of timing but pricing as well. Compared to other ways that you can access help, the benefit of this is that you can come in, and instead of waiting weeks for your scan and your imaging and then having to wait again to see the consultant, which will often even happen within the private sector, and we can do everything in-house. That's how the system is designed, really with patient satisfaction at the heart of it, so that you come in with a question and you leave with an answer.
Fantastic.